Okay, this is my audience. How would you feel if you gave someone money to help them out, but then you find out that they spent it on alcohol or illegal substances? Now, I know I would be pretty mad about this, considering I was worked for that money and I was trying to be a nice person and help someone out. This is happening all over the United States. People pay their taxes and a portion of it goes to a program called welfare. This is a very good program that helps a lot of people get back on their feet by giving them money to pay for bills, buy food, and even pay for childcare. But some people are abusing this program by using their welfare checks on alcohol or drugs. This is why states are starting to talk about making all welfare recipients pass a drug test. According to my survey analysis on SurveyMonkey, almost all of you agree that welfare needs more regulations. This is a great thing because it makes sure that people's tax dollars are helping the people who truly need and want the help. Before I can explain why this is such a good thing, you need to know exactly what welfare is. Welfare began in the 1930s during the Great Depression. The federal government would give money to those who need it. According to U.S. welfare system, Help for the U.S. Citizens, when Bill Clinton was elected president, the Republican Congress passed a reform that gave control of welfare systems to the states. The federal government provides assistance through TANF, which stands for Temporary Assistance for Needy Families. This is a grant issued to each state to disperse to people who need the assistance. So the federal government says how much money each state gets, and then the states divide it up among the people that they think need it the most. There are many different types of help that welfare programs offer. These include things like food stamps, free daycare, free or lowered rent or house payments, and so much more. You can also receive checks that you can use on other household necessities. Now, welfare isn't just something that gets handed out to everyone. There are certain guidelines that people must follow to be eligible. The guidelines and rules vary from state to state, since each state is in charge of their own welfare system, but the general guidelines consist of you making only so much a month, you get help if you have more dependents, and you take classes to help learn how to get a job. There is also a time limit for how long you can receive welfare, but if you still need help, then you can reapply and they give you extra time. You also have a caseworker who checks up on you and helps you get things done. Now that you know the gist of welfare, let's look at one of the big problems they are facing right now. Since the beginning of welfare, people have taken advantage of this wonderful program. In 1996, Bill Clinton signed a welfare reform to add stricter guidelines like time limits, and requiring everyone receiving aid to work or train to prepare for work. According to a 2012 article called Welfare Reform as We Knew It, after Clinton signed the reform, caseloads plunged from 12.6 million in 1996 to 5.9 million in 2000. Health and Human Services Department studies showed that most found work and saw their incomes rise. As you can see, making more restrictions weeded out the ones who didn't need it and made the ones who needed it work harder and learn better ways to help get them a job. Now, if we turn your attention to my list of stats, this survey was done in 2007 by Substance Abuse and Mental Health Services Administration, and as you can see, 18.5% of unemployed adults use drugs, and only 8.8% of full-time employed adults use drugs. And this is a pretty good sample because the sample size was 67,500 people. Now, these results aren't saying that 18% of welfare recipients are drug users, but it is saying out of a very large sample, whether receiving welfare or not, the unemployed have a greater chance of using drugs. I think this does a good job showing that people have a higher tendency to do drugs when not employed. And having a drug test is one more little step in helping a person stay clean and not spend their money on drugs. According to Jack Kingston, Congressman of Georgia's 1st District, asking someone who is unemployed to do his or her part by staying eligible to work is common sense, he states in U.S. News in December 2011. If the recipient isn't abusing drugs, then they should have no problem passing the test and should feel proud of themselves for taking the right steps to help get them back on their feet and prove that they applied for welfare for the right reasons. Now, if you were in welfare for the right reasons, how would you feel if some people who were abusing welfare and were lowering the amount of help you got? Drug tests would help tighten up guidelines so money is going to the people who truly deserve it. The law would require you pay for your own drug test, but if you pass, you get reimbursed for this. So it's not like you'd be losing any money if you're clean. If you don't pass, though, you don't get reimbursed, as you shouldn't, because if you can afford drugs and alcohol, you shouldn't be given welfare. Another good point I've seen brought up quite a bit is if people have to pass a drug test to have a job, then people should have to pass one just to be given money. This makes sense because if someone has to be clean to work hard for their money, then the person that their tax money is going to for welfare should definitely be clean too. Jobs that require drug tests aren't assuming everyone that applies are drug addicts, just like making welfare recipients take a drug test isn't assuming that they're all drug addicts. This is just one more step to make sure that you're hiring the right person for the job, and for welfare, making sure that the money is going to the right people who really need it. The final positive I'm going to mention is it would help people who really need it. How many times have we been told that drugs are bad and can really hurt your body? A lot. And unfortunately, people still try them and sometimes get addicted. So for those who are addicted to drugs and can't stay clean, requiring a drug test would help give them an incentive to get clean so they can get the benefits of welfare. Once clean, they can receive the help they need from welfare, and instead of spending the money on drugs, they can use it for more important things like paying bills. In conclusion, by making a drug test required to receive welfare, we aren't assuming all welfare recipients are drug addicts. We are just ensuring taxpayers' hard-earned money is going to the ones that want it and truly need it for the right reasons. There are so many positives to approving this law, not only to ensure the money is going to the right people, but also to help that people who are addicted to drugs get clean. Welfare is a great thing, and we should make sure it stays a great program for those who truly need it. Okay, and this is my audience again. Okay. That was funny.